Hello class, this is your presentation for the medical skill assessment for DH199C. Anytime that we are seeing a patient in the dental office, it is required that at every single dental appointment we obtain a full comprehensive medical history. We do this because we want to make sure that the patient is healthy enough, or if there's anything going on in their medical history that we need to be alerted to prior to performing any dental treatment. To do this, we want to make sure that the patient is seated in a comfortable position, and we want to have eye-to-eye contact with our patient. At Herzing, we do have a signature pad that is available for patients that have a difficult time getting up out of the chair to sign their medical history at the computer. If you choose to use the signature pad, this would need to be plugged into the computer prior to opening up EagleSoft. Once the medical history is obtained, please make sure that when your instructor comes over that you introduce your patient to your pod instructor. This enhances professionalism and respect for the instructor and for your patient. Once you have navigated through EagleSoft and you've gotten to the patient's medical history, we are going to start the interviewing process. We do this through the questionnaire. This questionnaire will walk you through exactly what we want to know from your patient. Couple things to take note. When it asks, is the patient under a physician's care now? If the patient is on any prescribed medication, they are under a physician's care. Ask them if there's been any hospitalizations or any major surgeries. We're looking to see if there's been any major surgeries to the heart or to the limbs that has resulted in a joint replacement. Ask them if they're taking any medications. You can ask them if there's any tobacco use. Ask them if they have any allergies. So this is going to give you a really nice way to walk your patient through this questionnaire. As you scroll down on the page, you will see the following conditions. You will note on the upper right corner, there's this little box that says no to all. My recommendation would be is to click that box. Once you click that box, all of the conditions listed below will automatically turn to no. At this moment, you can ask your patient to review these to see if there's any of these conditions that they have. You can switch the individual condition to a yes. When you do that, the yes is going to turn red, and that's going to indicate that we need to be asking a little bit further information upon that condition. So for example, if the patient states they're diabetic, a couple questions we want to ask is, when was the last A1C taken? What was your A1C? Do you take your blood sugar on a daily basis? If so, what was it? Did the patient eat that day? And how are they feeling? If a patient states that they have high blood pressure, you can ask them following questions. When were you diagnosed? Is it controlled by medication? Do you take the medications as prescribed? So anytime that you are in a position and a patient says yes to a condition and you're not sure what questions to ask, the best question to ask is, when were you diagnosed? This will lead into a further conversation with the patient to have a better understanding of what's going on with that patient systemically. As you continue to scroll down the page, you are going to see a comment box. This is where we're going to document everything that you have collected through the interviewing process of your patient. Here, you're going to put the full date. You're going to place the patient's vitals, any allergies, such as medications, the reaction, and when it occurred. And then, as we just talked about, the conditions, such as if the patient was a diabetic or high blood pressure. And we would document here what the patient has told us. We would list the name of the medications the patient is on, what the medication is for, and what are the dental considerations of that medication. Please know that every single medication, what they take it for, and the dental consideration should be on its own line. We would prefer not to place it in paragraph form. It makes it very difficult to read. Then from your desktop, there are going to be some COVID questions that we are going to copy and paste. This is an example of what we are looking for to be placed in that comment box. We want the full date, so here we have January 18th, 2023. We have the vitals, which is 120 over 80. The RA means right arm. We got 60 beats per minute, which is the pulse, and then we have a respiration rate of 12. The allergies, the patient has an allergic reaction to amoxicillin, developed a rash in 2015. The conditions, so the patient had marked yes in one of those condition boxes, stated they had type 2 diabetes and was diagnosed in 1997. The patient ate 2 hours ago, checks the blood sugar daily, which was 80. The last A1C was taken back on December 15th, 2022, and it was 6. The patient was also diagnosed with high blood pressure in 2001, and it's controlled. Patient also states they have anxiety, and it's controlled without medication. So we have a really good understanding of what's going on with the patient's systemic issues. Then we go into medications. The patient is on metformin. They're taking the metformin for the diabetes. The DC means dental considerations, and you're going to take the dental considerations directly out of your Vital Source drug reference book. And you can copy and paste that directly into this area. You'll go on to the next medication, Lexapro. They're taking it for anxiety. The dental consideration is xerostomia. Next one is concussion, 2020. Appendix removed, 2010. Patient is gluten-free. Patient uses smokeless tobacco. And then we copy and paste the COVID questions that are on your desktop in the clinic. The reason why it is so important to document the medications and what we're taking them for is because there are a number of medications that are on the market that are used for multiple purposes. For example, metformin, yes, is most commonly used for diabetes. However, it is also used for PCOS. Wellbutrin is a medication that can be used as a smoking cessation, but it's also an antidepressant. These are why it's important that we ask our patient, what are you taking the medication for? After you have completed your comment box and all of your information is in there, you're going to navigate through Eaglesoft to the memo. Here, you are going to enter in the patient's emergency contact. We want their name, the phone number, and the relationship to the patient. For in the instance that something does happen in the clinic, we want to know who to contact. We also want to know who the dentist is. Now, if the patient has not seen a dentist and they don't have a dentist on file, it is okay to write unknown. At Herzing University, it is required that a patient does obtain a comprehensive exam from a dentist every 3 years. So if we see a patient that hasn't seen a dentist, we will continue treatment, but then once the treatment is completed, we would refer the patient to a dentist to have that comprehensive exam completed. At that point, when the patient does return back to our clinic, we'll be able to fill in who the dentist is. For the dentist, if they have one, we want the name, the phone number, and address. If the patient is under a physician, we want to know the name, phone number and address. Again, if the patient is under medications, they should have a physician documented here. If the patient is not on any medications and they state that they're not seeing a physician, it is okay to say unknown. The hospital must be documented. Again, in a case of an emergency, we want to know where the patient wants to be seen. Many patients will say, well, just bring me to the closest hospital. This is the opportunity where you would need to go online and find out what hospital is closest to us. Again, we would need the location, the address, and the phone number. Once the information in the memo has been compiled and completed, then you're going to navigate through Eaglesoft to your patient's Smart Docs. What we are looking here for is making sure that the documents that the patient filled out is scanned into their chart. We are looking for the registration, we are looking for the authorization of treatment, and the HIPAA forms. Now, if your patient is a new patient, sometimes the front desk team gets very busy and they don't have the time to upload the documents right away. And this is okay. We just have to make sure that all documents are scanned in prior to the patient leaving the clinic. So if it's not scanned in at the time of your medical history, just let us know that. And then when we come back at the end of the appointment with your patient, we will make sure that those documents are properly scanned into the patient's chart. When it comes to alerts, if the patient has any conditions that have been marked yes, this will automatically show up as an alert. The alerts that we need to add will be the patient's staging, if there is a pre-med that needs to be done, or if there's a medical consult that needs to be sent out, or if we're waiting for it to return, or if there is a comprehensive exam that is needed prior to the patient returning to HU. I did put down here how to place an alert into the patient's chart if you forgot. Please note that sometimes if it's a new patient, we may not know the periodontal stage yet, and that's okay. We would check the alerts again at the end of the appointment to ensure that that perio staging was entered. Once you have completed your interview with your patient, you have filled out the questionnaire, you have completed and documented everything that was necessary in the comment box, you have navigated and placed everything that you needed in the memo, you have looked into Smart Docs to make sure all of the documents are properly scanned, and you have reviewed the alerts, you're going to stop. And you are going to navigate to Blue Note. It's kind of hard to see in this picture, but on the very lower, there's a red circle. This icon is going to bring up your Blue Note. You will see that you'll see Unit 1, Unit 2, Unit 3, Unit 4. You're going to click on the unit that you are sitting at. So if you are sitting at Unit 1, you're going to click Unit 1, and there's going to be a tab that says Medical History. And you're going to click on that. That is going to communicate to your pod instructor that you are ready for your medical history check. At this point, you are going to wait for the instructor to come over. You're going to introduce your instructor to your patient, and you're going to walk your instructor through the medical history. You're going to show them your comment box. You're going to show them your memo. You will show them your Smart Docs, and you will show them the alerts. Once this has been signed off by the instructor, then your patient can get up and sign the box. Once you have notified your instructor that you are ready for your medical history check through Blue Note, you're going to go ahead and navigate back to where you had your comment box in the medical history, and underneath that comment box, you are going to see an area for the patient's signature. At this point, you're going to have the patient sign for their medical history. Once that is completed, you are going to click on Accept, which is circled in blue, and then you are going to click on Print Answers. I know this is weird, but by printing the answers, it actually automatically saves to your Smart Docs. Once you have completed the medical history, then you are going to take what's in that comment box and you are going to copy and paste it directly into your SOAP Note template. This presentation is going to go over the dental social history skill assessment. The dental and social history is a continuation of the interviewing process that we do with our patient. After the medical history has been completed, you're going to continue this questioning and interviewing with your patient by asking them what their chief concern is. What brings them into the clinic? Are they having any dental issues? Are they having a toothache? Do they have a broken tooth? Are they having any sensitivity? Depending on how your patient responds, ask follow-up questions. Ask them to the point to the tooth that's bothering them. Ask them the location. Ask them how long it's been going on for. Gather more information. You want to be able to get enough information to be able to explain all of this to your doctor. You will also perform CAMBRA. This will be in your flip chart, and this is going to determine the patient's caries risk, whether they're low, moderate, or high. Then you will perform the periodontal risk assessment. This is the grading and staging process of your patient. You will do this through your radiographs and through your clinical assessment. You are going to want to obtain additional information of the patient's dental history. You're going to want to know what their last dental visit is. What was the full date? Where were they seen? What was completed? The last dental visit isn't when the patient saw their dentist last. It's where they have been seen just in general. Were they here at Herzing University? Were they at an ortho office? Did they have a tooth taken out? The last dental exam, this is where we're going to want to know what the full date is and the location. Remember, if the patient has not been seen by their dentist within 3 years, the patient will need to obtain a comprehensive exam from their dentist before they can return to HU. We're going to want to know what the last full mouth set of x-rays is. We want to know the full date and the location. That way we know if we're going to be taking x-rays here or if we need to get them transferred in. That goes for the same thing for bite wings and the pano. Then we want to ask the patient if they've had any past dental treatment, such as ortho. Has the patient had a history of scaling and replaning? Did they have an extraction? This gives us a better idea of what the patient has been through. And then we always want to ask the patient, how do you feel about coming to the dentist? This question is important because we know that a lot of patients do suffer from dental anxiety. By understanding this question is going to be able to give us the opportunity to understand how we can help create an environment for the patient that is calm, comfortable, and safe. We also want to ask about their social history. What are their habits? If the patient states that they are a tobacco user, we want to follow up with the 5 A's. Ask, advise, assess, assist, and arrange. Ask them about their snacking habits, the frequency, soda, juice. Do they bite their nails? Are they clenching or grinding their teeth? Do they wear a night guard? Continue to ask your patient if there's any popping or clicking or pain while opening their jaw. Your patients are going to be sitting in the chair and their mouth is going to be open for quite a while. So having an idea of if they're having any pain in their jaw is going to be able to give us a better understanding. Do we need to give this patient more breaks? Do we offer them a bite guard? We also want to have a better understanding of their personal oral care. Personal oral care is also known as POH. We ask every patient at every appointment, how do you care for your mouth each day? What we're looking for is their brushing habits, their flossing habits. Are they doing anything that's adjunct? So questions to ask is, are you using a manual or an electric toothbrush? If they're using an electric, is it an Oral-B or a Sonicare? With flossing, are they using string floss or are they using floss picks? Do they use soft picks? Do they use anything to get in between their teeth? Do they use mouthwash and which kind? Do they use a water flosser? And if so, which brand? What kind of toothpaste are they using? Are they using a whitening toothpaste or tartar control toothpaste? And we want to ask the patients what if they have any concerns regarding their teeth. This kind of opens up the conversation of if they don't like the color of their teeth, we can open up the conversation of whitening. Maybe they don't like the rotations of certain teeth, and we can open up that conversation with orthodontia. It just creates an environment of asking these open-ended questions to really start to know your patient. The good news is you don't have to memorize that. On your desktop, you will have a PDF file that has your soap note template. We can open up that in a Word document, and it's going to show exactly what it looks like here. And it's going to walk you through everything that you need to ask your patient. So right there you can see CC. You're going to document if there's a problem, and if so, what the symptoms are, tooth numbers, location, duration, and problem. The last dental visit, it shows right there the full date and reason and location. Same with the exam. You can see it's for x-rays as well, for habits, for your POH. So you can use this template to walk you through asking your patient these questions. As you ask your patient these questions, you're going to delete everything that is in parentheses, and you're going to type in what the patient states to you.